Hi, welcome to the Balance HI podcast. I'm your host, Samantha Lugine. So I've been having this burning question in my head that I'm not really happy that I've had it because it feels like doubt. And I hate having this doubt. But my question is health information a dying profession? I feel like 10 years ago, it was like a hot topic. You got to get into it. It's something new and fresh. We've got the EHR emerging. We've got technology coming into play in healthcare, and it's a game changer. You know, we need more employees that have knowledge in that field. It was exciting. It was thrilling. It was new. It was an adventure. And now I feel like it's been quiet. It's been silence for some reason. It's been a forgotten field somehow. And it's like, how? We're in your face. So it's like, how could you forget about that profession? And I feel like it's because there's just not enough investment in education. What do I mean by that? I mean exactly what I said. Not enough investment in education. I have worked for a program for about 8 years in health information on the associate's degree level. And that program has now dissolved. Do you know how disheartening that is? And it's like, wait, but there's so much more we could have done. We haven't even reached our peak. We were just getting into the groove, and I thought we were getting the bachelor's degree accredited. Oh, I missed that part, didn't I? We were also accredited. All that hard work, whoosh, down the drain. And why? Because people still don't get what we do. A lot of jobs, a lot of schools, just a lot of programs are not familiar with us. They're familiar with the typical, nursing, dental, law, those typical, doctor. And it's like, well, what about the rest of us? What about the rest of us that do not want to do any of those areas? So now we're the unsung, right? So here is health information as one of those unsung professions. We're so important. When you need data and information, you come to us. But we're not important enough to invest in. We're not important enough to have professionals recruited to work in the field that are actually knowledgeable and have confidence. And I think that's the most important thing about this. When you are educated and trained and you have invested and your employer has invested, it makes you confident in that field because you have all of this wealth of knowledge bursting out of you, waiting to share, waiting to expand, to spread around, to help others. Better yet, to improve your field. That's why I enjoyed it. That's why I got into it, because I wanted a way to improve healthcare without being the typical clinician cutting into the patient or assessing the patient physically, but I can help in a different way. I can be behind closed doors sometimes, because sometimes you do see the patients and we're not invested in. That is the key thing. So to have a program dissolve, to have this ambiguous state now of where are we going? How? Technology has made our field advance to a level that we are so unexpendable. So how did we get here? Technology has made it to a level where we were needed for the EHR to optimize it on the next level. We were needed for the data sharing, right? Exchanging healthcare data, we're still needed for that. We're still needed for the EHR optimization. We're still needed to release records. We're still needed to code and build the charts. We're still needed in the revenue cycle realm. So how did we get here? And how do we make it stick? So back to my question, is health information a dying field? And what are we gonna do about it if we do feel this way? One of the things that I'm going to make an effort No, that doesn't sound very hopeful, right? One of the things I am actually going to do and actively do is continue doing my research and how to expand the education process when it comes to health information. I am a child that loves to do research. I am a person that likes to figure things out. I'm a person that thrives in chaos, as bizarre as it sounds. That I want to know how to make things better. I want to step out there. So one of my peers told me that you want to change the education system, you want things to be different, you need to go to legislation. So you've got to figure out, okay, how do I present this to legislation? I mean, I would love to, my associations that I'm a part of to back me up and support me, which then I need to make myself more available, present in those associations. Because who's going to back you? They don't know who you are. They don't know what you stand for. So those are my goals that I have to do. Because one of my things that I feel is the most important is why don't we invest in the current employers in that field right now? There's a lot of employees out there that wish that their employers, because they're a part of the union, this is possible, would invest in them the same way that they invested in the coding and the nursing, would love for that investment. Because there's certain areas in HIM, without a doubt, should have a certification. And that's what I loved about some of these associations out there, that they do have micro credentials, micro certifications. A great example of having some kind of certification in that area so we do not die, because we are important, it is needed, is release of information. That is an area that I 100%, the more I sit as an HIM director, that I see that is an area that definitely needs a certification. That I wish that our union dived into that area more and presented a certification for that area. That they will, of course, fund for those employees. Because how could you feel confident releasing a record? I mean, the standard record, a patient comes in, requests a record, lab work, or maybe the entire record of that visit, and you hand it over to them, and then you feel confident. But then what happened with those scenarios where patient expires and the family that survived them comes and they want those medical records, and you have an incident where, oh, I'm a friend and I want a medical record of my friend that passed away. And you're like, hold on, this is strange. Oh, their family member said it's okay for me to pick up the record. So if I have had employees come up to me and say, what do I do in that case? Even though they have been releasing records for like maybe 5 years or less, they are still not confident. Yeah, that's a real thing that does happen. That is something that should be addressed. Oh, how about this one? Let's flip it now to a different area in HIM. What about the analysis? The ones that are analyzing the records for missing signatures and documents, applying those deficiencies that somehow turns into delinquencies, no matter how many times we contact the providers to complete those records so that they are not incomplete, and that we don't do administrative closures. Now, what about the analysis? We train, and when I say we, it's mostly the HIM directors, managers, assistant directors that are training the union staff to analyze these records. These records, man, that are coded by a medical biller that is certified. It just sounds like a conundrum to me that the medical biller needs to be certified, medical coder biller, but not the analyzer. I will never understand. And I'm glad I will never, because then that means I am complacent, and I'm not complacent. I want to make a change. So imagine analyzing a medical record for completion and not knowing different document types, not knowing the criteria of certain documents. For example, if you're looking for the standard H&P language, history and physical, but the document type naming convention is not H&P, what are we looking for? They wouldn't know. It will be up to the HIM director or the HIM supervisor to educate them. And sometimes we don't have the time. Or there is an education, but the employees are not confident. See that word? It's coming back again, right? Is not confident about their analyzing of records, especially with those hot new procedures out there like the cardiac cath, interventional radiology. It's confusing to them. It is so confusing to them. Document types are different. It's just the process, the workflow of those procedures are completely different from a standard completing a procedure form or a operative note. It's completely different. So for them to not have the confidence to apply erroneous deficiencies, so not only pissing off the providers because they're like, what's wrong with your staff? They're incompetent. I say that because I've had a provider say that to me, those exact phrase to me. Pissing them off, wasting their time, or even worse, getting suspended erroneously because we're applying deficiencies because we don't understand the document types, because we don't understand the procedure, because we don't have the education, because we're not confident. That was a mouthful I said there, but that is important. I think it's important to be redundant in what I'm saying about the confidence in education and investment and having the HI field that do not die out. Health information has been reduced to only 2 professions that I see prominently discussed, invested in: medical coding, CDI. Medical coding, CDI. Why? How did this happen? How did a field that I got into, because I felt like, wow, we're about to do something different here. We're about to shake up healthcare with all that's happening. I'm a millennial, so I'm a fan of technology. Then we got AI. So what are we doing here? There's so much we can do. And we've been reduced to only 2 things that are very important in health information. How did that happen? Why is analysis not spoken about? Why is ROI not out there more? Why are we not discussing more of these topics? I didn't even touch on, health record management when you're actually scanning and indexing that data and ensuring that it's appropriately inputted into the EMR and the naming convention is accurate to what the document type is. I haven't even got into that because I feel like that is more of like an entry level of health information, getting into the field, that at least you can get your foot through the door and start there and then move your way out. To me, the record management team, as part of the chart completion team, are what used to be the file clerks, picking up those charts, filing them away, ensuring that they're complete after analysis is complete. There's no deficiencies in the record. That is the parallels of record management and file clerk. So we need to engage. We need to go to legislation. We need to speak to the programs. I want to ensure that there's not another health information program that doesn't dissolve because the powers that be do not understand where health information can go. The misconception is the only people that need a certification or education is the director and a coder. Yes, that is what was said because that is what we presented as health information, that it's only needed as the director or the CDI or the coder needs to be certified, but everybody else is just fine. No, technology has changed that. Everybody else is not just fine. Not only that, but even having them do the in-services with an EMR system that educates them on how to navigate through the tool. That has been another issue as I sit as a director that I've seen out there. Like, why are we not investing in them? Why should it only be relied on that the HIM director is the one to educate them? Some of those employees have been there before me. And sometimes as a new director, those employees will be there before you, before implementation, that they were already using the EMR system probably over 2 years now. And then you come in. I think with the recent pandemic, it has showed that we should not be a dying field. We should be a field that is invested in. not a forgotten field. I feel like we have become the unsung healthcare professionals. But you know when you need a medical record, who to come to. You know when there's data that needs to be sent out to the CDC or to any of those establishments that need research for the population of health, you know who to call on, because technology has made data more accessible. And who are the individuals that are the data stewardship of those records? We are. So why wouldn't you invest in our field? HIM professionals are in the center of managing data securely or even accurately to ensure that information that's being put out there does not lack integrity. Of course, CDI has been popular, but I think we're beyond that. We've expanded beyond CDI. We expanded beyond coding. You know, there's data analytics out there and health informatics. There's privacy and compliance. A lot of the organizations do provide micro certifications in those health data security and privacy. There's the EHR optimization. If more of us can be that actually worked in the field and were an end user for an EMR system, I think these things will be a bit different. I say that from experience of using an EMR tool that's so frustrating that I say, who created this tool for HIM? There's certain things I'm just like, I don't understand. Even in the coding aspect, I'm like, we do not use the tool this way. It should not even function this way. It's so wildly inappropriate when you cannot produce productivity reports because the people that created it, they say they have the same certification as you, but I'm not sure they ever worked in the field, because if they did, they would have said nay to a lot of the functionalities that exist out there and would have said yes to how to improve that tool. To me, those are the things that make me feel like, is this a dying field? Because I feel like it has become a running joke where we're just throwing tools that do not work properly. For scanning and indexing a record, to analyzing a record, not being able to do certain functionalities, such as apply primary and secondary cosigners. That was one of the things that was like an antiquated tool that I never thought would go away, that I thought would have been enhanced, but for some reason has disappeared as technology has advanced, which I'm like, that makes no sense. Because if you're a teaching hospital, such as the ones that I've worked for, there's always two signers. There's always two individuals creating a note. There's the resident, which is the medical student, and then there's the attending or the hospitalist that has to co-sign, or often they want to make edits to those documents. You know, simple things like that, or releasing of information. Having that when you're pulling the medical record, where it alerts you that these are the documents missing. Just simple things that if an individual that was working in the field prior to working for an EMR and an EHR system would have known to ensure that was part of the functionalities of the tool that an HIM professional is using. Just saying. And then information governance. Ensuring that data is not manipulated or altered to falsify information. Informatics usually takes on that role, and I think that also was a misstep in the healthcare world. That HIM should have never been pushed out of that, because then that would make us a dying field, right? Pushing us out of something that is in our face daily, that we would conduct those audit trails. We would see what documents are being canceled, because you can't delete documents, right? We often are in that EMR looking for those information and analyzing those charts for completeness. So the ownership of informatics having that should not be 100%. It should have been 50-50. And then the big one. Don't you feel like health information plays a big role in cybersecurity? Shouldn't we be a part of creating the policy and procedures for cybersecurity, being that we are the ones that lose majority of that data? As I said, we are the data stewardships. So when the patient comes in, hey, I want my medical record. Oh, we're so sorry. That data was part of the ransom of the cyber attack we had so and so years ago. We never paid that ransom, because we know that if we pay the ransom, they will come and attack us again. So your data is gone. So it would be important to have us a part of that conversation a part of what went wrong, a part of how long will our downtime be, because one day downtime is catastrophic. A week downtime from an EMR is like World War III. It's data being mismatched. If you're thinking merging is an issue, now imagine having paper records. Loose paper is the worst thing ever when you're trying, and then you have to scan those records, and then the manpower you need to have. HIM needs to be a part of that conversation. Can we go beyond of the certifications of RHIA and RHIT? Or do we stick with those certifications and ensure we provide micro certifications? Does it matter to the level? Because I know that RHIT can be given to associate level programs. So why not present that to our HIM representative, coordinators, etc., to give them that opportunity, to have their union be a part of changing that aspect for them, where they are being more confident because of the investment that we are putting into them. So HIM programs need to adopt more informatic programs. How about that? More analytic programs, policy education. Those are programs that I think that is a great start for the union to present. And of course, anatomy and physiology, the medical terminologies, those are all important as well as prerequisites to progress in health information. Professions who stay current, and I'm talking about those who are in the field even without the degree. If you stay current with the technology, the analytics, and compliance, you will remain highly valued. If you accept new emerging technologies, such as AI, and become familiar, because I'm telling you, AI has not only taken other areas of healthcare, but it is very, very prevalent in health information. From when you're scanning a document, we can now have an AI tool name the documents for you instead of having to choose those document types. Because if you ever work in a facility like mine who has 100 document types, it could be a waste of time, sorry to say, to name each document: consent for procedure, consent for general, consent for anesthesia. Like, there's so many document types that exist out there, where now the AI tool will read that, and all the HIM representative has to do is go back and verify that that information is correct. The AI tool even reads the patient information to see if it's accurate. For analysis, you can use AI to just check for the standard H&P operative notes for any of those services that do require the standard documents. For release of information, I would have to figure out that part, what AI could be used for. But we know for coding, it's been assisting with coding and CDI. There's just not an area that's not going to be touched by AI. It's going to penetrate every area, and it's going to make it easier. The unfortunate part is that it may decrease a couple of functionalities. But this is when you should embrace and you should learn, because technology cannot do everything. Computers cannot do everything. There needs to be a human individual verifying. Oh, forgot one. AI also is in transcription, where a provider no longer has to write a document. They can just transcribe it by clicking an application or a button on their computer, and the entire encounter is being transcribed by the AI tool. But an individual is definitely needed to review that information, take out the unimportant stuff, because sometimes, when you're having a meeting with your physician to patient level, you say, hey, how was your day? How's the kids? How's the grandchildren? You scrub that off of the chart and just get to the nitty-gritty of the importance of the care for coding and billing purposes, right? So again, how do we ensure that HIM does not die? We invest, we educate, we train, we certify, and we keep on growing. We also have to do outreach. The same way nursing programs are promoted, clinical programs, occupational therapy, respiratory therapy is promoted. It's the same way that we should be putting up those banners out for health information to get those people in, get people interested into data analytics, get people interested to the privacy and security, because those are like areas that are really growing and really important for the purposes of preventing threat to a healthcare record and data. And even understanding information governance and understanding why policies and procedures are in place, avoiding duplicate medical records and redundancy so a patient can receive the proper care. Also, I think promoting health information is something that we should think about. How do we promote it and get it out there besides just putting the banners and the broadcasts? How do we raise public awareness? Such as using this podcast is one, or using social media. I know I use TikTok and I use Instagram to promote out there. And I got time to use LinkedIn. I've got to get into using that as well to raise the awareness of the association programs that exist out there and to wheel some individuals into our field. Doing a day in the life as a health information professional is probably something I should think about doing. Have someone follow me with a camera, see if that's appropriate. Or even collaborating with other departments or areas, such as, we collaborate with IT, we collaborate with quality, even with the EHR systems out there, such as the Epics and the Allscripts in the world, or with privacy security projects. And just, as I was saying, advocating, circling back to legislation, advocating for policies and standards, joining and using support groups to begin this initiative of ensuring that our field does not die, promoting the HIM roles and conversations of health equity, data standards and digital transformation, going out there on career days and speaking on the allied health and IT fields, partnering with local colleges and high schools to offer internships and presentations of the HIM career. I love taking interns from the colleges. I've done it with so many colleges such as BMCC and Nassau Community College, where I love to take them. I look at the curriculum. I have them meet with key stakeholders that the health information professionals do work with, such as tumor registry, the patient advocacy, risk management, our internal legal counsel, informatics. It just makes them see that there is a broader aspect out there. And I hope that I have changed and impacted individuals when they do internships. I don't just have them sit there and do the work that we don't want to do, like putting away loose papers. I do have them working on projects we've got this legal case closet here, called the red closet or the flag room or etc. Now, how do we ensure that we get rid of this? Because we do have an EMR system that allows you to flag charts. So physically printing those documents that are digital is just not necessary, or it's not best practice. And just essentially just another way we can just leverage data and to demonstrate the value of health information, right? Like I said earlier, we've got the pandemic showed our value. I guess we need to remind the public and the education system that it's needed for documentation accuracy, that for reimbursement rates, for compliance scores, because I know when CMS comes and they're looking to give us our stars, one of the things is documentation, is that H&P presence, is the operative note present right after surgery. Those are things that are being looked at, and I think it's overlooked at who are the ones that are scrubbing those charts to ensure that those documents are present. An HIM professional, patient satisfaction. Oftentimes patients want their records and they want to review and they want to amend, and we're a part of the satisfaction process for them. I say, I guess we should promote more newsletters out there on HIM, nominate internal or national awards. I guess will put us out there as well. Just spitballing here. There's just many ways that we can make ourselves more prevalent in our areas, in the faces of our community, to ensure that we are shown the importance of health information and collecting that data. Thank you for your time, everyone. I hope to see you guys around. And of course, you can follow the podcast, actually, not just me, Balance HI on TikTok and Instagram. And then be sure to follow me on my LinkedIn.